My name is Camus Stoiter. I am currently the Service Area Administrator for the Division of Children and Families responsible for our programs in the Douglas and Sarpy County areas. I've been with the department for 19 years. I started right out of college, honestly, as a frontline case manager and did that for about 6 years before I moved into supervision and then administration. So the frontline staff and the frontline work is really where my passion is and where it comes from. That's the work that I miss doing, but I really like being at the administrative level and getting to be a part of these innovative and exciting changes to get us to better outcomes. So this is kind of an overview of what we intend to talk about in our agenda today. We'll give you some data and current information just to give you some context about what the Eastern Service Area looks like right now, and that kind of helps set the framework for why this important change is happening. We'll talk about the history of prior sub-awards and prior involvements, prior amendments, and how we got to where we are. We'll talk about why we're moving forward with this new RFP. We'll give you some information about the transition timeline, what the transition activities look like, so you know what the next 6 months look like. We will then talk to the St. Francis leadership, who will give you a presentation about their agency, some of their innovative strategies and things that they plan to bring to Nebraska, and then obviously the question and answer section. So for our context about the Eastern Service Area, that is made up of Douglas and Sarpy counties. We make up 44% of the state's child welfare population. We're the smallest geographically, but the largest population-wise as far as our child welfare involvement goes. There's about 751,000 people in the Douglas and Sarpy County areas. About 208,000 of those are 18 and under. In our Eastern Service Area, we have approximately 27 providers that are serving our families under our current subaward recipient. And we have 1,075 licensed or approved homes. Now that 1,075 homes includes kinship and relative homes. They are what we call approved homes. They may or may not be licensed, but they are kin or relatives to the child. That's really an important distinction for us and something we're very proud of, both in our service area and in the rest of the state, is our movement towards ensuring kids can be with relatives or kin whenever possible. In our Douglas and Sarpy service area, 69% of our children in out-of-home care are with a relative or kin, and that's a big increase over the last 5 years. Some information about our influx of families that come through our child welfare system. We have a statewide reporting hotline that functions 365, 7 days a week, 24 hours a day. They take all incoming calls for statewide child abuse neglect and for adult abuse and neglect, as well as information calls. Of the calls that they receive, about 15,700 are relevant to child welfare calls in the Eastern Service Area, so in the Douglas and Sarpy County areas. The next category gives you some data around who those callers are. So about 5,000 of those calls are accepted, and then the categories below break down from the total. So you can see that our primary callers are usually relatives, neighbors, friends, schools, and law enforcement. Those tend to be our high volume callers. In the 2000 calendar year, 2018, there was 1,983 substantiated victims from those initial assessments that started through the hotline. And then as of last week, in the Eastern Service Area, we had 1,801 open cases, and that is broken down into in-home families and out-of-home children. That's just kind of our language about how those counts are counted. In-home families, that one's really small, 350 in-home families and 1,451 out-of-home children. So the in-home families are typically more than one child, but that I think is right around 600 actual children in those in-home families. These graphs give you some trend data starting back in 2014 about the differentiation between in-home placements and out-of-home placements. One of the things that's really important to us, both historically and going forward, is improving our data on keeping kids at home, moving our service array up front, looking at front-loading services, doing any possible strategy we can to work with families up front in our initial assessment phase to prevent removals from happening. We know that usually, regardless of how bad the situation may or may not be at home, a removal of a child from their home and their community adds another layer of trauma, that if we can put services and preventative measures in, then we can keep them at home while still providing services. So these graphs just kind of show what that trend has looked like. And we're moving in the same direction. We still have more kids out of home than in home, but we want those lines to start merging and cross each other. One of the other things that's important is that there's 510 average days that a family is involved with our system in a court-involved case, and 83 days that a family is average involved with us on a non-court basis. And what we see when we look at outcome data, the re-entry rate and the recidivism rate is not necessarily any statistical difference between those two. And so if we can serve a family more efficiently in their community, together as a home, without the invasive systems involved, and still get good outcomes and keep those kids safe at home, that's what we want to do. This depiction kind of shows you from the hotline call through the referral for services. So the blue circle is the hotline call coming into us. We use a tool called structured decision making, which is an evidence-based model that we use from the hotline through initial assessment and through case management. So the structured decision making tool at the hotline screens the information that the hotline worker receives against statute and policy to determine if that information meets the criteria to open up further involvement with the department for an assessment. If that happens, then we move on to the yellow circle, which we also use structured decision making in our initial assessment role. We do a safety assessment, a risk assessment, and/or a prevention assessment using that evidence-based model. So taking out some of those implicit biases, using a group decision-making model to ensure that we're thinking about all options we can to keep those kids safe. That determination is then made about safety in the green circle. We also make a determination as risk based on the structured decision-making model. And then based on what those two assessment tools tell us, we move on to the magenta-colored circle and look at what appropriate services that family might need. Obviously, that is an assessment we do with the family. That's an important language distinction. We try and ensure that our staff are doing assessments with families and not on families. We need that information. We need the history from the family. We need their buy-in. We need that transparency in that conversation so we can do a really good job of assessment. One of the common misperceptions that we often hear is who can remove a child. In Nebraska, the Department of Health and Human Services and CFS, we do not have the statutory authority to remove a child on our own volition. Only law enforcement can do a removal or a hold or a petition through the county attorney's office that is signed by a judge. We often work with our partners if we identify a safety issue that we can't mitigate in the home. So we can initiate an affidavit that could be considered by the county attorney's office and the bench. But in order for the child to be placed in our custody, it either takes that law enforcement action or a judicial action. Currently in the Eastern Service Area, the little dollar sign stands for the 4E federal funds that come to us from our federal partner, the ACF, and federal appropriations. The department is the federal pass-through of those funds, and then in the Eastern Service Area, we subcontract through our subrecipient award for case management services. That case management services box is currently filled by Promiseship, to be filled by St. Francis, and that provider then does all the service provision, employs the workforce, and does all the infrastructure around case management. The Eastern Service Area is the only one of our 5 service areas that is structured like this. In the other 4 service areas, the department staff provide the case management in those screen boxes. The next 3 slides are going to just kind of give you a visual depiction of the 3 subawards that we have had since the beginning of privatization in the Eastern Service Area, starting back in November of 2009. So the first subaward that was issued in 2009 was kind of our first stab at this. There was lots of amendments, 12, I think maybe, 11 amendments that were made in that first subaward. Mistakes were made, things needed to be changed, there was finances that needed to be solved, there was infrastructure, case management roles and responsibilities, and some statutory changes as well. So there was lots of amendments in that first contract. The second subaward started in July of 2014, and it had multiple amendments as well. You can obviously see the dollar changes as well as the different programmatic amendments. And then our current subaward in the Eastern Service Area began on July 1st, 2017. It was a 2-year plus 6-month extension of that subaward. So it goes through December 31st of 2019, and that's the current subaward that we are currently in until the end of this calendar year. This graph, or this slide shows you in kind of an overlay graph about the 4 different subawards, including the most current one that was just RFP'd out, the yellow bar, and then the black line shows you the number of children that were being served in that contract. So the dollar amounts of the contract compared to the kids being served in that contract has ebbed and flowed over time as well. And obviously this subaward contains administrative costs and then costs per child. So the current environment in the Eastern Service Area and some of the things that we are intending to move forward with this new RFP and the new subaward with St. Francis, as well as our own internal work that we're doing within the department. Obviously, we want to continue to have a shared vision and common goals that lead to better outcomes for kids and families. That's really kind of the foundation of the work that we do. All of our decisions should be based on what's best for kids and families and getting to better outcomes for them. We want to be able to measure those outcomes and to have some way to verify those outcomes, a way to hold providers, ourselves, and our subaward recipient accountable for those outcomes. The need for system stability, obviously that's important for families and staff and stakeholders and the general child welfare community. The need for improved collaboration. This town hall is an example of one of those things, wanting to have better collaboration with not just our system partners, but our public partners, our families, our foster parents, our providers, our court, making sure that our transparency is visible, that we're having the conversations, and that we're not making decisions in a bubble. The need for improved innovation and vision around Families First Prevention Services Act, FFSPA, which I will refer to just as Families First because it's too many words. So the Families First model kind of shifts our ability in federal drawdown funding to do more focused funding on in-home strategies rather than just out-of-home strategies. So it changes our paradigm around our funding sources and allows us to fund evidence-based and promising practices that help support our mission to keep kids home and in their families. The need for strong community partnerships. And one example of this is the Bring Up Nebraska initiatives. In Douglas County, we have the Douglas County Community Response, and in Sarpy, we have the Lift Up Sarpy Community Response. So those are initiatives under the larger umbrella for Bring Up Nebraska, where we're trying to bring up prevention models that also have the support of fiscal funds to allow for flex dollars and case management for families outside of the formal system, so that we can refer, schools can refer, families can refer themselves prior to ever having to come through our hotline call center. The need for strong family preservation services, which I spoke a little bit about before, as well as the overall continuum of care. Obviously, with that focus being on family prevention, safety planning up front, moving our service array to be front-loaded so that we can help families sooner and stronger. So the vision for the Eastern Service Area really relies on these 3 circles: improved outcomes, increased innovations, and increased collaboration. Okay. So the Eastern Service Area, the new RFP has some changes and some additions from the prior RFPs. This matrix shows what some of those are. So some of the things that are additions to the new subaward. The new subaward has performance-based outcomes that has some financial incentives around that to ensure that our overall goal of getting to better outcomes for kids and families is achieved through this subaward. It has language in it regarding the Family First Act. So under the Family First Act, there's some provisions that the federal government has outlined as far as prevention services being evidence-based, promising practices, and funding those upfront services and in-home services. So that's built into this subaward as well. A subaward oversight with its own dedicated contract oversight administrator, who is Mr. Manhart here. CQI reform, also built into the contract, that feeds back up into the improved outcomes and performance-based measures. And then an innovative case management tool, looking at how different states have done case management, how that's worked better, how that's worked differently, and bringing some of those new innovations to Nebraska. One of the things that's new with this new RFP and subaward is a readiness review assessment. So the readiness review that we are currently in the process of working on with St. Francis Ministries involves, I think, around 72 measures that we are tracking, assisting, and kind of checking off to make sure that our partner is ready to assume case management. We don't just want to throw things out there and hope that we're ready. This readiness assessment really helps us know that this process is ready to roll. It has things like finances, operations, infrastructure, IS&T, case management readiness, and ensuring that there's a trained workforce to meet the needs of our families. There's 4 new measures around financial accountability, 13 new measures on service delivery, which also includes some of that family first language, 24 new measures based on performance and outcomes, so overall 43 new performance measures in the new subaward. I can't see that far away. So the new ESA subaward, the open communication, fostering innovation, shared vision, and family focused. Really the proposal that was submitted by St. Francis Ministries met those core components and had a service array that really met the needs of the Families First model and did so with improved innovation and increased efficiencies. So here is our timeline going forward. The new RFP for this subaward was issued in January of 2019. 2 bids were received. Department of Administrative Services posted the intent to award in June of 2019. And our transition period is the period we are in now, from June to December of 2019, where lots of activities have to take place to ensure that the transition is as smooth, as seamless, and possible for families and stakeholders and staff. The readiness review should be completed or is intended to be completed by November 2019. We're already starting some of those activities now, but that is when we hope to have that completely checked, boxed off. And then transition complete January of 2020. As a part of the transition, and in our question and answer sections later, we can answer more questions specifically about this. This garnered a lot of questions in our last couple of sessions. Currently, there are 9 transition teams that are part of this transition period from June to December of 2019. These are some of them: quality management, planning and coordination, financial oversight, subaward accountability, operations and logistics, communication. We also have work groups on human resources, on a mobile rapid response team that's intended to be able to be a stopgap fill if we need to have coverage for caseloads and triage for caseloads in the middle of the transition. These transition teams meet weekly. Some of them have external stakeholders and judicial stakeholders involved in them. We'd like to increase that external stakeholder membership on those teams. Right now, the majority of those teams are DHHS staff and St. Francis Ministries staff, so we would definitely like to have additional partners on those transition teams. Just in these teams, just from our 2 agencies and some externals, we have over 90 child welfare people involved in these transition teams, working and looking at all the different angles and trying to answer questions before they become a problem. The public is you guys. I know all of you here have a vested interest in the success of this transition and the success of child welfare in our service area. You really make up the core of this work. Transparency, accountability, and stakeholder engagement is really pivotal to make sure that all of that functions together so that we can do what's best, have improved outcomes for kids and families, and satisfy our stakeholder responsibilities. So looking forward, as a part of that, transparency and accountability, this is a slide that gives you our Eastern Service Area Transition website. This PowerPoint, which some of you also got hard copies of, is on the webpage. You can go there to have your own copy. There is also question and answers that have been submitted to the department and will continue to be posted on that website. There's some other fact pages. There's links to the St. Francis Ministries pages and to some of our Department of Administrative Services websites so that you can review some of the RFP documents if you'd like as well. And with that, I will turn it over to Father Bobby to give you some more information about St. Francis.
I am a deep believer that community happens through relationship. And what we are embarking on together is the building of relationship. As I hope you come to learn, St. Francis has been part of the larger Nebraska community since 2012. And now we're honored that that relationship begins to deepen. And I have some slides that I'd like to go through and make some introductions of some of the team members that are here with us. But really, really, really am looking forward to the question and answer period and the conversations that happen after that. A lot of really important engagement and relationship building happens in that rather than just hearing from me. So I do have some information I want to go through with you. Tom Blythe is with us. Diane Carver is with us. Tom's our Chief Operating Officer. Diane is our Vice President for Child and Family Services across our system, our continuum of care delivery. And today, in the last forum, I was introduced to Jody Austin, who's here with us again. Jody, stand up, say hi. Jody joined St. Francis 2 days ago as our new Regional Vice President for the work here in Nebraska. So delighted that you're here. Officially starts on the 19th. Yes. So thank you for being here. At St. Francis, I say, our board of directors joins me in saying that we have a mission and vision that is simple and simply bold. Our deepest reason for existing is simply to offer healing and hope to children and families, and to do that in a way that transforms lives and systems in ways others believe impossible. We currently employ about 1,200 people. Our leadership team, our board of directors, all 1,200 of us orient ourselves to that cause every day for the people we serve. We go about the building of these relationships, the delivery of care, the achievement of that mission and vision based on 4 core principles. No one more important than the other, but together collectively form that strong foundation. First, quality, ensuring that the services we provide, the therapies we provide, the engagement we provide is something that is measurable, can be monitored, can be improved when necessary, and can be demonstrated to our stakeholders, to our clients, to everyone involved, that says what is delivered into the lives we hope to impact positively is something we can all be proud of and is based on quality. Going around the horn for baseball fans, going around the horn, everything we do should be about respecting the individual dignity of every human life that we come in contact with. The people we serve directly, the families we partner with, the foster families we engage, the child placement provider community, DHHS, everyone involved in community. A commitment to honoring respect and dignity in all of those lives. Innovation is sometimes a misunderstood concept. So at St. Francis, we define it as not necessarily bringing something brand new into a space or into an environment or into a context, but taking what we do and finding ways to make it better. And lastly, in this diagram, the value of empowerment. Empowerment of those that we work with as employees so that they have the tools and the resources necessary to make wise decisions, empowered decisions, not always having to check with someone else to gain approval to do the right thing. Empowerment of the clients we serve, the children, the families that we get to walk with as they go through these various processes. Because we have a fundamental understanding that people who do the work, people who are closest to the work, understand best what is necessary for our mission and vision to be achieved. Collectively, we believe those things bring us towards success. We do this in all of these states where you see highlighted with the red stars and the gray stripes. We also engage work in Central America and Honduras and El Salvador. We seek to advocate and influence public policy through ways in Washington, D.C., and in New York City at the United Nations. And as I said, we've been here in Nebraska partnering with community since 2012, and we're honored to be invited into this next level of relationship. Our work here in Nebraska is in the western region, some pictures of our staff here in Nebraska, and the pull-out quote that says, "A life transformed." That's really the story of a young woman, 14 years old, who'd been removed from her home, been in the system, going through the various aspects of the process, the therapy, and part of her healing. And I just say part of because we know it's a journey. But part of her healing was her ability to recognize, as I say, all the junk that she had experienced in the years of being involved. All that stuff just was not her fault. And for her to be able to verbalize that is a necessary and important part of the healing experience for that young woman. I've touched on this in a variety of ways, but fundamentally, we do not do this alone. Community is built, as I started with, through relationships. It's built in relationships with a whole host of individuals and organizations and systems that we experience in any community. It's with our provider network. It's with the department. It's with the schools. It's with traditional health care. It's with behavioral health care. It's with judges and law enforcement. And if I didn't say your particular piece of community, it's not because I don't care. It takes all of us in relationship to move towards the common good. And now it's my honor to hand the clicker over to Diane, who's going to go deeper into the conversation around our model. And again, I just want to say thank you for joining this conversation today, and I look forward to our more informal time together.
Thank you, Father.
Thank you.
Good evening. Thank you for coming today. I will just briefly talk about our model, and then during the questions and answers, we can dive a little deeper. The RFP is for a full array of services. So our model includes family preservation in-home services as well as out-of-home services. Our service delivery is such that we will be bringing to Omaha what we currently serve in the west and central part of Nebraska, as well as in the other states, a model called family-centered treatment. And then we will continue to serve families through the provider network around intensive family preservation. Ongoing services is the case management piece around placements and healing of families to reunify or other permanency options if needed. We have been honored to have this contract for just a little over a month. And during this month, we have worked with providers to learn. We have certainly talked with several providers. We haven't made all of the providers rounds yet, but we intend to do so. And we want to learn what services are provided, what are we most proud of, what are some of the service gaps in Omaha. As we do that, we are developing our partnership agreements with providers and a provider's manual that will outline the work that will be contracted with us. We are almost completed with that work. It will be part of the transition planning with the department, and that information will be shared, and then we'll be ready to move forward with providers. I know that's a question that's been asked all along. How soon will we know? What services is going to be provided by what providers? We are partnering with DHHS and PromiShip to determine how to transfer families. And so we have seamless transition, and families have little to no impact. Our goal would be that PromiShip staff are able to lift out their caseloads and desire to come work for St. Francis to provide and continue that relationship with the families. We are securing office space, and at this point believe that we will have 2 offices, one in Douglas, one in Sarpy. We are hiring staff, and as you saw, Jody has just joined our team and will be the leader in Omaha. We are certainly interested in hiring Omaha staff and those who are currently in the child welfare system to continue to serve and work with families and children. We are looking at the IT systems and how they interface, how our system interfaces with DHHS, with InFocus, in order that we can collect the data and meet the outcomes of the contract. And with that, I just invite you to learn more about St. Francis. And there are several members of the team here tonight. And so those of you from St. Francis, if you could please raise your hands. Some here, some over here. So if you're not, thank you, Morgan. If at the end, after the questions and answers, if you have some specific questions, search out any of us, and we'll be glad to answer your questions if you have an individual question you would like to ask. So with that, I think we're ready to begin questions and answers. So thank you.